Have you ever wondered what it's like to perceive reality differently from everyone else? Today, we're delving into the world of schizophrenia. This severe mental disorder affects approximately 1 in every 300 people worldwide. It's characterized by significant impairments in perception and changes in behavior, creating a different reality for those living with it. People with schizophrenia might experience persistent delusions, hallucinations, disorganized thinking, and even extreme agitation. It's not unusual for them to have persistent difficulties with cognitive functioning. But, let's be clear, schizophrenia is not about having a split personality, as often portrayed in popular media. That's a common misconception. In fact, schizophrenia is a complex condition that affects how a person thinks, feels, and behaves. It's a serious mental health condition that requires understanding, empathy, and effective treatment. Despite the challenges, many treatment options exist, offering a ray of hope. Schizophrenia is not a split personality disorder, but a serious mental health condition that affects how a person thinks, feels, and behaves. Schizophrenia is more common than you might think. Around the globe, it affects approximately 24 million people. That's about 1 in every 300 individuals. Regardless of age, gender, or socioeconomic status, no one is immune to its reach. It's a condition that significantly reduces life expectancy by 10 to 20 years compared to the general population. Despite these staggering statistics, schizophrenia is often misunderstood, mistaken for multiple personalities, or viewed as a result of personal weakness. Despite its prevalence, schizophrenia remains one of the most misunderstood mental health conditions. What causes schizophrenia? Is it genetics or environment? These are questions that have puzzled scientists for years. Schizophrenia doesn't have a single cause, but rather, it's thought to be a complex interplay between genetic and environmental factors. Genetically, it's been found that individuals with a family history of schizophrenia are more likely to develop the disorder, indicating a hereditary component. But genes alone aren't responsible. Environmental factors also play a critical role. For instance, exposure to viruses, malnutrition before birth, problems during birth, and psychosocial factors can all contribute to the onset of schizophrenia. Additionally, certain risk factors increase the likelihood of developing the disorder. These include having an older father, drug use, and experiencing traumatic events or high levels of stress. So, while the exact cause remains elusive, it's clear that both our genes and our environment shape the development of schizophrenia. While the exact cause is unknown, both genetic and environmental factors contribute to the development of schizophrenia. Scene script. How does schizophrenia manifest and how is it diagnosed? Schizophrenia is a complex disorder with a variety of symptoms. These can include persistent delusions, where individuals hold untrue beliefs despite evidence to the contrary. Hallucinations, where people perceive things that aren't actually there, such as hearing voices or seeing images. And disorganized thinking, where individuals may struggle to keep a logical flow of thoughts. Additionally, people with schizophrenia may exhibit highly disorganized behavior or extreme agitation. These symptoms in combination often lead to significant impairments in perception and changes in behavior. Diagnosis is a multi-step process. Healthcare professionals first conduct a thorough mental health evaluation and physical exam. They then rule out other mental health disorders and make sure that the symptoms are not due to substance abuse, medication, or a medical condition. The final step is a psychological evaluation, which includes observing appearance and demeanor, asking about thoughts, feelings, and behavior patterns, and discussing family history. Early diagnosis and treatment can significantly improve the prognosis for those with schizophrenia. Can schizophrenia be managed? And if so, how? These are questions on the minds of many. To answer yes, schizophrenia can indeed be managed, and there are several effective treatment options available today. Let's start with medication. Antipsychotic medications are primarily used to manage the symptoms of schizophrenia, helping to reduce the frequency and intensity of episodes. They are not a cure, but they can significantly improve quality of life. Next, we have psychoeducation. This is a therapeutic intervention that helps individuals and their families understand the nature of schizophrenia. It provides knowledge about the disorder, its treatment, and ways to manage symptoms. This can empower those affected and their loved ones, enabling them to respond effectively to challenges. Family interventions are another key part of schizophrenia management. They involve the person's family in their treatment process, equipping them with skills to support their loved one effectively. These interventions can help reduce relapses and hospital readmissions. Lastly, we have psychosocial rehabilitation. This approach focuses on helping individuals with schizophrenia regain their social skills and functional abilities, aiding them to lead fulfilling and meaningful lives. It may involve vocational training, social skill development, and other supportive services. Remember, every individual is unique, and what works best will vary from person to person. Therefore, treatment plans should always be tailored to meet the individual's specific needs and circumstances. Despite the challenges, with the right treatment and support, people with schizophrenia can lead fulfilling lives.